healthcare. Healthcares are there only in the government setup, never in the private setup. This is the first time. And last 1 year, we have really got very good support, especially from the senior citizens. They're always forthcoming, and for all those things, and all the members, we have from ourselves tried our best to ensure that we are able to be of great help to the society and to the residents of the society. If there was definitely one thing I can tell you, that it's been a very good learning experience. When we started, there are a lot of things that we thought may be a little different. Like, for example, when I started, I thought that maybe a physician is the most important person in the society. But I realized after starting this is an orthopedic who is most important. The physiotherapist is most important. Because everybody has a pain somewhere or the other. And they need a physiotherapist and orthopedic. So this is an experience that has come through. Rather, my expectation, like, I thought that even the pediatrician would have a very good, but no, it's the orthopedic.
Seniors.
Yeah, so that's how, and so a lot of you have definitely come forward and helped us. Thank you so much for that. So I have basically 3-4 things to do today. One is the cake cutting that will happen. Apart from that, we are releasing a web app today. So where the patients and the residents can see the updates in that, as well as ask for appointments on that. Thirdly, now I'm very happy to announce that we are also starting the ambulance facility. And 24 hours, anytime you want. I've already increased the number. I've also circulated further to ensure that this facility is available to all of you. Plus, based on so what we did last 20 days, we have taken a lot of feedbacks from the residents who have actually used the facility and their feedback. So I think it's been very, very encouraging. So I have also compiled their, the entire video for all of you to see that what is their expectation. I am so happy that we have been able to really help so many of them in such a critical condition. In the sense, there's one gentleman whose mother had fallen in the bathroom, fractured, they were not able to move anywhere. I provided X-ray at home, orthopedic at home, who did X-ray and everything at home. So nothing else was required, everything was completed at home. And I think one of Mr. Amit Mahajan is there, his father who was, he's still critically ill. And we have been able to, provide facility to him. Like we have created an entire hospital atmosphere inside his house. So with a hospital bed and nurses and everything, whatever is required.
And I must add, I have called him at really odd hours and asking for even small things like a stethoscope. We are not prepared for anything of that sort. And their staff, a lot of critical activities, because when you are in that kind of a state, there are a lot of things where you need people who are ICU trained, and I am really thankful. I mean, these guys are God sent for me. So,
thank you.
So our sister is ICU trained. She can put the Riles tube, which is a very critical thing. Otherwise, you have to go to a hospital to get the Riles tube inserted. So
she's
that's
also
a very
cameraman.
So all these facilities, giving IV and all those things that we are doing here, and so and times to come, we will definitely add a lot of other things here to ensure that you don't have to go out. Most of the things will be available here. One of the things is that we are also tying up now with the corporates, where being a resident, you will get a special facility in the corporate hospitals. That will definitely be. Plus, I am working with experts to build up a health package for the residents. Where, so it will be like a package where you can avail a lot of facilities within that package. So I am working with some experts to get that, so that may take some time, but that is definitely in plan. So we will do the cake cutting now. I'll request Vinita ma'am to please do the honors.
Before we proceed, I would like to thank Sandeep sir who has started this initiative during his tenure. And I had come for the first meeting with you, where I've seen the interaction between you all. I was very clueless. I didn't know it would reach here, where it's become so beneficial to everybody. And I congratulate you on this first anniversary. And I request all residents to support this endeavor because it's very useful for all of us. Thank you for serving SCL in this 1 year. And we hope you continue to do so.
Thank you.
आइए, आइए। आप आइए।